point of this event, the whole point of INC is to make sure that when you guys do start applying and looking towards your careers, you guys are best prepared. And so the best way to prepare you guys, I think, and all of IHG things, is that to give you the most amount of information possible. That way when you guys do make your decisions about what field you want to go into, about what you want to do once you're in that field, you know exactly where to go. You know what you should be looking towards, you know what problems they face, and also you know who to look for help.
Ozlem, Equils. My background, I'm a pediatric infectious diseases physician. I'm a faculty at Adjunct Associate Professor at Cedars-Sinai, UCLA. I'm a medical director at Pfizer for the last 7 years. I started MiOra to help improve diversity in healthcare and STEM careers that help students just like you, and also students from more challenging backgrounds.
My name is Monica Soni. I'm an internist by trade. I'm actually from Los Angeles originally, and then went to Harvard for undergrad, went to Harvard for medical school, and trained at UC San Francisco in the primary care track at San Francisco General Hospital, which is a county hospital. I returned back to LA. I actually started on faculty at Keck doing both inpatient and outpatient medicine, and then now work for the County of Los Angeles Department of Health Services, so it's the safety net system for all of our county. I own a Martin Luther King Outpatient Center in South LA. I do direct patient care there, and then I'm an administrator, so I spend a big chunk of my time overseeing the primary care clinics, urgent care, transitions of care work, thinking about integrated behavioral mental health, and then I do some inpatient medicine as well, but primarily a primary care doctor and an administrator for a public safety net system.
I'm Chris Costa. I have a very, very different background, different perspective. I'm from a very, very small country called Gambia. I did my high school there, and the Gambia is a country that didn't have a university until recently, or a medical school, so they sent me to another former British colony called Zambia, which is where I went to medical school and did most of my medical training. This was a school that was run by the University of London, essentially, so I was sent to the University of London to complete my studies. And after doing some training, initially starting off doing surgery, decided that that wasn't what I wanted to do. I went into immunology, infectious diseases, and tropical medicine. So I did a master's and a PhD in immunology, and then I came to the States, decided to move to the States. I originally was coming here as a fellow at the NIH. I decided to do my residency in Las Vegas, internal medicine, subsequently did a year of critical care training, and subsequently also trained as a wound care and hyperbaric medicine physician. So this is why I say it's very convoluted. I've done a whole host of things, and right now I find myself in the pharmaceutical industry, where I work in drug development for sepsis. So for me, pre-med wasn't an option, it was mandatory. So when I went to med school, you basically had to do 2 years of pre-med, but you really did it at a very high level: chemistry, organic chemistry, physics, etc. But it was very oriented to the practical aspects of medicine. So for physics, for instance, you did radiation physics, you did things pertinent to radiology. For the biology we did, it was human biology. And then we did 2 more years of preclinical work with the anatomy, physiology, and so on, pharmacology, biochemistry. And then you got a bachelor's degree. So that was integrated into medical training. And then you had 3 years of clinical rotations. And so a 7-year program for undergrad is what I did.
I was better at the humanities, to be honest, than I was at math and science. I mean, I was fine at math and science, but that really wasn't my strongest skill set. So I was an anthropology major, I was a social anthropology major in undergrad. And so, you have to do all the pre-med stuff along with your concentrations, what we called it. So I had lots of doubts along the way. I had lots of questions. I struggled more in the science and math courses than I did in my other smaller tutorials, which felt like home to me. So there were lots of questions to me about whether or not I had chosen the right path for myself. I went into medicine because I was mission-oriented about it and passionate about that particular piece of it. So I did a lot of community service, working in clinics around both in Los Angeles and also in Boston. The research opportunities that I sought out were all about underserved populations and vulnerable populations. What I want to encourage folks to do is do what makes you feel excited. So if you're building an application anticipating that someone wants to see a particular thing, they're going to see right through it. So I danced all through college. You know, I did jazz ballet, I did hip hop, I did cultural dance, and I spent sometimes 40 hours a week probably in dance practice and performance. And that is what I put on my resume, and that's what I put on my CV. And actually, in one of my interviews, somebody actually asked me to dance, and then joined me, actually joined dancing. You know, medicine more and more is looking for people who are well-rounded and excited and passionate. So whatever that happens to be for you, that's what you should do. But I wasn't some cookie-cutter student. If you took time off and you work in some other industry, you could always come back. First of all, the post-bac route is extremely well-traveled. Lots and lots of people do that. That's a possibility too. Working and having real life experience is very, very enticing to medical schools as well. There's nothing that's limiting you. You know, finish the stuff you need to finish and then give yourself a break. You don't have to go straight into medical school. If you're not sure, I would strongly encourage you all not to go straight into medical school, right? You don't want to start and then drop out. That is, I mean, you can, of course you can. But you don't want to do it because it's expensive, there's a commitment that you need, and that's someone else's spot also, right? So, you know, take the time to figure out what really is a good fit for you. There's no clock that's running in the background.
A couple of things that I would encourage you to do, if possible. One is to visit a foreign country, less developed country. Try to get immersed in community health type work, rural clinics, urban clinics, all kinds of settings in developing countries, because it gives you an appreciation of some of the, you know, challenges that physicians have in these settings. And, you know, it really helps you gain a perspective on how people in resource-poor settings actually manage to provide health care to a significantly high degree to people without all the bells and whistles you have in the United States. Because I work in the pharmaceutical industry, it's a very, very big unknown amongst medical students, pre-meds, going into medicine, as to what happens behind those gray walls of the pharmaceutical industry. And what I'd encourage is, during a gap year, for those of you who think you might consider that as a career path, is to go to a large pharma and try and do some rotations in large pharma. In all these companies, or in the majority of these companies, they'd actually love to see students, or pre-med students, come in, spend some time, rotate. Some companies have formal programs where you approach them and they'll say, yes, we have a program, we can get you to stay with us as an intern or sort of mentee and rotate for several months. This is something I want to encourage you guys to think about, is that don't pigeonhole yourself necessarily unless you really professed you want to be a particular specialty. Don't be afraid to go into med school and to get towards the end of med school and then make a decision. Don't be afraid to go into residency and then to change course. Medicine's very exciting. There's so many different avenues, so many different things you can do. In my own instance, there was a medical student 3 years ahead of me who became my mentor, who eventually went into the same PhD program I went to at the University of London. But the key thing he said to me is not do this or do that, but what do you want to do? Make sure you focus, question yourself all the time, talk to as many people as possible before you make a decision.
Certainly when I was thinking about specialties, to me it was how do you, again, best serve the population I was interested in. And so unfortunately, often emergency medicine is that path. So I really strongly thought about emergency medicine as it ends up providing a lot of primary care for certain folks who don't have the same kind of access. But I sort of, again, the continuity relationship was what led me into primary care. But even after that, there's been a few different things that I spent my time doing. So, I did a lot of inpatient medicine, so hospitalist work. Then I did urgent care, a lot of residency education. I was in academia initially and then moved into more of the county public health sector. There was one particular mentor who worked in a community clinic outside of Boston. It was considered a FQHC, certified qualified health center, so affiliations with another hospital, but really it was a standalone clinic. And they have a different financial structure than a lot of other settings. And she was the medical director of that clinic. So I watched her see patients. When I started to apply to medical school, I talked to her about the process when I was thinking about community medicine and primary care. I talked about the frustration there too. She had 2 small kids at the time. She was married, trying to navigate being a medical director and also family responsibility. She kind of talked me through that as well. So she was very, very helpful to me in thinking about, was I making the right choice? Having my eyes wide open, knowing that it wasn't going to be ponies and bunnies all the time, that it's going to be hard at times, and that it was really a life choice that I was making for myself. I've been surprised in medicine how much the personal connections and relationships makes a difference in terms of hiring and where you might want to go, or other people modeling careers that you didn't even think about as a possibility. And so just being very mindful of, this is your network now, it will continue to be your network. A lot of times where people end up doing residencies, where they end up staying for fellowship, and where they end up staying on faculty as well. So that starts here and continues all the way through.
Early on, I wanted to become a doctor, neurosurgeon, because that was the toughest thing to do, and there weren't that many women neurosurgeons. And then later on in high school, I really liked physics. So I entered into medical school, and I loved research. And when I was graduating, I thought I want to do PhD. I don't want to see patients, I just want to do research. And then I realized that I don't have that much experience to do PhD, and doctors do research. Doctors you can do an MD, PhD type of program, and you can have both clinical practice and research. And I had publications, and then I went into fellowship, and I went into a more academic career. And then as I was having, at theaters, and so that assistant professor, associate professor, both clinical and research, and NIH grants, then I had kids. And one of my kids was getting bullied, and I found out about it by coincidence. And I said, okay, I need a different lifestyle. I can't be gone all day, leave in the morning, come back in the evening. I need a more flexible schedule. And right again, recruiters always pharmaceutically. At that time, I had experience with clinical research and clinical trials. So I moved into pharmaceutical industry. Every person you talk to could be a mentor in a certain capacity. It's how you approach things, right? They may say one thing, like I asked this one professor at Johns Hopkins, what do you think, what's the secret? And everybody that I visited, that I met, I asked that question. And his advice was, find someone who's going somewhere and willing to take you with them.
Basically, it's about as much as what you do in med school or pre-med as what you do for your extracurricular life. I got through it by just being a teenager, young adult, doing all the things outside of school with vigor, with as much vigor as I did studying. We were the party animals, and I was particularly known for, people used to say, how does this guy do this? And then he's top of the class. Because it's about having a balanced life. And the point I'm trying to make is that you have to have a normal extracurricular life. Do all the things that are normal, the norm for your age, and don't be a nerd. It doesn't have to be partying. I mean, if you're interested in sculpture or archaeology or whatever you're interested in, just do it with vigor and, do your med school stuff with vigor, equal vigor. That's how you're gonna get through and survive. If you keep focusing on thinking, I'm gonna go through this, it becomes more challenging.
I told my husband one night, I never did an all-nighter. He was like, you never did an all-nighter? I was like, nope. I worked hard, I planned, I prepared, and I went to sleep. That is how I got to sleep. And he knows how important sleep is to me, and that's, that is something that's nourishing and important to me. If it's making sure you exercise, because that is what keeps your mind focused. You should do that. These are things that are going to help sustain you all the way through, but it's not just one thing. That's not going to make a good physician or healthcare provider or healthcare professional, right? Nobody wants that person in their med school. When I started at USC, we saw 70% uninsured patients, and we're now about 80% insured patients. So that is dramatic. 1/3 of Californians now have Medi-Cal, which is mostly managed care Medi-Cal. So it's 1 in 3 people in California. The Affordable Care Act has been enormously successful by almost any metric in the state of California, because the state really started planning ahead for it. For us in California and most places in the United States, the Affordable Care Act and Medicaid expansion has been managed care. So, sometimes people talk about managed care, it's a dirty word from the 80s. For us, it's actually been very important in the county system. We really were doing kind of whatever came to the doors, whatever we kind of tried to take care of. It was emergencies and emergencies and emergencies. That's not the kind of care we are striving to provide anymore in Los Angeles County. So now you have a population that you serve and that you're responsible for. You have quality outcomes you have to accomplish and prove to the state and prove to actually the federal government that you're using the money in a meaningful way, right? Not that you're just doing whatever kind of care, but that you're doing high quality, excellent care that's supposed to be provided.
I think what that's leading to now is that we have more and more nurse practitioners, PAs, that are kind of filling that void. And these specialties that are becoming better and better trained, because the gripe before was that NPs don't have the requisite training. PAs probably do to a larger extent, but their training is becoming more and more sophisticated. But then you really can't compare 2 years or 3 years with the rigors of what you go through as a physician in terms of medical school and residency. So there is still a gap.
Right, so most primary care providers in Los Angeles County are not accepting new patients because there's not enough primary care providers to go around. So now the population is mostly adult folks who were, lower income, who didn't have anything before, who now have insurance and are in the system. So we cannot keep up with the demand across the state of California for sure, and it's been the same experience in other parts of the country as well.
Healthcare reform in general has been primarily focused on access. You heard Dr. Soni talk about how things are switched around in California to 80% access to insurance. Now, I want to talk from the perspective of, I worked as a wound care hyperbaric medicine physician until late 2014, and I ran a clinic in a suburban hospital in Philadelphia, where I saw upwards of 25 to 30 patients a day, with wounds and also in hyperbaric medicine. And the frustration I saw in that job was that, wound care is a very specialized field where you have different types of dressings for different types of wounds for different types of patients. You send them home with home health care. 1, 2, 3 days later, home health nurses calling you to say, oh, the insurance denied this particular dressing for this particular patient because it's too expensive, and they want you to treat the patient this way, which from a medical perspective is suboptimal treatment. So what I'm getting at is that insurance companies really do dictate how medicine is practiced in many regards. That's just one small example. And that's what the Affordable Care Act has not addressed.
Around Affordable Care Act, I love it, there's quality care. So what is quality care? Quality adjusted life years. How do you choose treatment? Because you will be most likely working in a large healthcare system. It's unlikely for providers to be having just their individual practices. Most of them are merging or being bought up by large organizations. So you have to kind of learn how to function in that setting and use electronic medical records and guidelines. So there's going to be an increased demand for primary care providers. We're seeing a lot of pharmacists providing care. There are pharmacists who run clinics in the retail pharmacy settings. They provide care. So you will be interacting, say you decide to become physicians, with a wide variety of professionals that are providing care. But now you can do so many combined things. You can finish this and then go and learn about how you do art. And there's art therapy, there's music therapy, and there's so many different things that you could do. So just be open-minded, talk to as many people as possible, and stay excited and keep on going.
So you get an idea of what you're getting yourself into. Because when I started training, after I went into training, there was some real surprises in terms of the rigor of the training, the demand on your time, the sleepless nights. When I told you about the surgical training I did, and I did 48-hour shifts for 2 years with 12 hours between each shift. Things like that. So I think it's good to get an idea of what the expectation is. And it's not all negative. The more you know, the more you're informed ahead of time, the easier it is to get through it. And I think overall, the interest and love you have for medicine is what is going to carry you through. And don't forget the other part of it is make sure you party as much as possible, as well as work. And that's going to take the focus off, how do I get through this very rigorous program? Okay? Don't forget that.
All right, well, on that note, thank you guys for coming.